Today, we are going to talk about obesity, nutrition, and I've added one word or a phrase which is very important for every family physician to understand, and that is metabolic health. As a nutritionist, I vouch for the statement that let food be thy medicine and medicine be thy food, which was, documented by Hippocrates many, many years ago. But I go one step ahead from this statement and I say that your food can work as medicine, provided you use it like a medicine. You are all family physicians and doctors. How do you use a medicine? It's a specific compound which you quantify, you define the frequency and say that, yes, you take it, it becomes a medication. Today, the science of nutrition has advanced so much that we can actually draw a checklist of everyday food. We can quantify it, we can define the frequency, and I can say that this is your checklist of everyday food. If you use it on day-to-day basis, believe me, it works like a medicine. So basically, what we are trying to say is that what you give to your body on day-to-day basis becomes a substrate for various body regulators which are synthesized in the body. And there is huge amount of science which is available to nutrition scientists and nutritionists, because based on that, we are in a position to identify the physiologically active components in food. We can quantify and we can even define the frequency that in a day, how much of that should be incorporated so that it has beneficial effects. Now, let me bring you to another perspective. Very often, we get overwhelmed with, terms like obesity, overweight, underweight. These are all different forms of malnutrition. But in an Indian scenario, we are very peculiar as a population. We have not only double, we have a triple burden of malnutrition. So on one side, we have gross undernutrition. On the other side, we have gross overnutrition. And in both ends of the spectrum, we have what we call as the micronutrient malnutrition. And more than that, what we also have very peculiar in us is that at lower BMIs, we tend to accumulate more
On obesity
body fat.
management.
Now, what is obesity? Essentially, if you define obesity, is excess accumulation of body fat. And I bring you back to what I was talking, that the moment you accumulate fat in your body, fat is a factory of hormones. So it starts, creating an imbalance, a hormonal imbalance in your body, and, triggers the synthesis number of what we call technically is the inflammatory markers. So to my mind, obesity is equivalent to high body fat, which is equivalent to high level of inflammation. And this inflammatory environment, if it is laden with micronutrient malnutrition, it is something like, it is a hidden bomb, or it's the tip of the iceberg, which will burst with a simple trigger. That's precisely what happened during pandemic, when we saw that in the second wave, a lot of young people fell prey to the pandemic. So here, where we went wrong was, very often in India, we relate our fitness to our looks. But let me tell you, looks can be very deceptive. You may have low BMI, but yet you may be carrying a high amount of body fat and low muscle mass, which means the inflammatory state of your body is very, very high. And if you've not paid attention to what you have been eating on day-to-day basis, you are definitely carrying micronutrient malnutrition. So it's a lethal combination of the two, which pushed young people into the virus, attacking them, and they getting affected And of course, with the pandemic times, our sedentary lifestyles, our stress, the various kinds of stress, the occupational hazards of sitting, which somehow unknowingly we all get trapped into. So these are all hidden contributors of inflammatory state. Now, the question is, why is metabolic health important? Okay. Now, if I have to explain to you that why metabolic health is important, let's understand that if I have to, classify a given population into phenotypes which are based on the metabolic health, I will find 4 types of phenotypes, right? I may have people who are metabolically healthy, and I'm sure all family physicians will understand that, the markers of metabolic health are actually your, markers of metabolic syndrome, the amount of visceral fat, the insulin, hyperinsulinemia, and the cardiovascular risk factors. So if you have more than 2 metabolic risk factors, your metabolic health is at stake. So you may have people who may be having normal BMI and no metabolic risk factors. But you may have people who are metabolically unhealthy, but they are non-obese. And that's what I was talking about when I said lean obesity. So it's the lean obesity which bothers, we as nutritionists and you as family physician, because they absolutely go, undiagnosed, and all of a sudden they are hit with a lot of trouble. Of course, we may have metabolically healthy obese. People may have high BMI, but they may be not having any abnormality at the metabolic health level. And of course, we will have metabolically unhealthy and obese. Now, why am I talking about this is because the moment your metabolic health risk parameters go up, remember there's a direct correlation of that with the state of inflammation in the body. And I already told you that inflammation is the trigger for all problems which we are having cut across age group, cut across all socioeconomic strata. Now, let me bring you to the first concept, which we as professionals have to guide our patients. We have to give them positive messages, and we have to tell them that management of obesity is not depriving yourself of food, but managing of obesity is the ability to learn the art of eating right. So eating does not lead to obesity. It's the wrong eating which leads to obesity. So that's one misconception which you have to tell people so that they don't go, haywire in terms of following extreme diets and disturbing the entire milieu of the body. So what is it that we need to tell them? We definitely need to tell and explain every patient the concept of healthy plate. So what is this concept of healthy plate? In an Indian scenario, you can relate it to an Indian thali. And you can have, 4 bowls in the Indian thali, not more than 4. Out of that 4, I would have 2 bowls filled with vegetables. I'll take this fruit out of this plate because this is from Harvard Medical School. But I'm trying to customize this to an Indian thali where I would have 2 bowls of vegetables. One will be raw in the form of colored vegetables, something which I can consume as a salad. And one bowl will be cooked vegetable. And again, reminding that potato is not a vegetable. Okay. If I have one bowl of potato bhaji, it's like I've already had 1 serving of a cereal. So 2 bowls of vegetables in the plate. So that's where my fiber is coming. That's where my antioxidants are coming, right? That's where my micronutrients are coming. The 1/4 of the plate is my healthy protein. When I say healthy protein, I'll elaborate a little bit about this more because to my mind, in Indian thali, this quarter is most of the time missing. And what gets overemphasized is the quarter of grains. So we have to give a very clear message that out of the 4 bowls, you need to understand what food group you need to prioritize. You need to prioritize your vegetable food group, half cooked, half raw. You must have a good quality protein in your plate, whether you have it as egg or curd or dal or non-veg, you know, so there are plenty of food sources which give you protein, and you need to ration. I underline the word ration the carbohydrates in your plate. And those carbohydrates should not be your white bread, rumali roti, khari, bun pav, but it should be a whole grain cereal. And today, I would vouch for millets, which every individual should look for the locally available millets, which should be added to this plate in this much quantity only. Why? Because millets are adding fiber, adding micronutrients to your plate. So, with this understanding of plate, a healthy plate, please keep a bowl of curd on the side, which is a bonus, which you can add, and keep a glass of water there, so that this is also to be emphasized that hydration is very, very important, and minimal use of oils, that is just about, I would say 1 level tablespoon, which is about 8 to 10 ml per person per day. So, this is where we are. We need to be giving the right perspective to people that by managing obesity is not to deprive you of food. Managing obesity is to know what to emphasize and how to strike a balance in your plate. So I again go back and remind you that which are the nutrients which need to be emphasized in the management of obesity. Of course, the first and the foremost is the protein, which I told you in Indian diets gets very much neglected. And, by default, most of the Indians are vegetarians. Even the non-vegetarians are vegetarian because they don't consume more than, 2 or 3 times non-veg food. The second important non-nutrient component, but it is like a nutrient, is dietary fiber. So it is so very important, not only in the management of obesity. We have studies to show that the moment you up your fiber intake, your body fat goes down, right? And not only that, it also has a direct correlation with your gut microflora. And today's science tells us the better gut microorganisms you have, the more of beneficial microorganisms you have, the better you have regulation of your hunger, satiety, and also release of those biochemical regulators which have a role to play in the management of obesity and even something like diabetes. Then we talk of healthy fats. But if you see the order in which I've put, so I need to emphasize on protein, but I need to understand what is good quality protein. I need to emphasize on fiber, and I need to know what will give me fiber, and I need to have good quality fat. So today, 2 handfuls of nuts is an easy recommendation from a nutritionist. And this recommendation comes with a caution that please limit the oil which you use in your cooking. Okay, please limit the high fat, salt, sugar snacks which you may be consuming, because Indians are known to be snackers, right? And especially the young Indians are heavily dependent on snacks. So science has revealed, and I'll share some of our work, that if you just replace these HFSS snacks with handful of nuts, and we've done some work with almonds, it has shown an effect on the not only the the HbA1c and the cardiometabolic risk factors, but it has also shown a decrease in the inflammatory markers. So, which is of importance. Now, going to proteins. So, as family physicians, I think you are the first contact with the patient. So, you have to guide the patient that This is the concept of healthy plate. You need to know your portions, and you need to know what will give you protein, first of all. So the first thing is that you get protein from so many sources. You get protein from vegetable sources, so which is excellent sources, your dals and pulses. And we Indians are blessed to have like a range of dals and pulses. If I start making one today, for the next 15 days, I will not repeat it because I have so much variety. And every dal and pulse, one bowl will give you 6 to 7 grams of protein. Of course, soybean topping the chart. Milk and milk products, excellent source of protein, but go for low fat milk products in the obesity management. One glass of milk, one bowl of 200 ml bowl of curd will easily give you 6 to 7 grams of protein. 6 to 7 pieces of paneer made out of low fat will give you, 6 to 7 grams of protein. So for vegetarians, if they are lacto vegetarian, I think it's a blessing because they get the goodness of protein from the milk and milk protein, so that whatever is missing in pulses as protein gets complemented and the protein gets utilized in the body well. Non-vegetarians have the benefit because like say one egg will give you 6 to 7 grams of protein. Egg white will give you about 3 grams of protein, and today we recommend 3 to 4 egg whites a day because it's pure protein, right? And it again has a remarkable effect on the management of obesity. Similarly, 100 grams, which is like your one palm size portion of meat, especially the lean cuts of meat, we would recommend chicken and fatty fishes, and but cooked in the right way, not fried, not converted into gravies, but either steamed, baked, marinated, grilled, or cooked on non-stick pan, so that you take the goodness of that 100 grams of chicken or fish, which will give you close to 20 grams of protein. Now, healthy fats, I already told you today as nutritionists, we vouch for good quality fat because they have a closest relationship to all the cardio-metabolic risk factors. So, what is the quality of fat which we are recommending? We are recommending a lot of emphasis on monounsaturated fatty acids, which you get plenty from all the nuts and oilseeds. Majority of the nuts will give you very high level of MUFA. And the second fatty acids which we emphasized is omega-3. And I will just share some of the details that some of the nuts are very good sources of omega-3. You also have, certain oil seeds like flax seeds, chia seeds, which are also very good sources of omega-3. But don't forget that besides nuts and oil seeds, if you're consuming millet, especially something like bajra, if you're consuming whole pulses, they are also contributing to omega-3 in your diet. And these are some of the fatty fishes, which all of you know, they give you the ready form of omega-3. Now, the third aspect, which you really need to emphasize to your patients, is that you don't only need to, understand your macronutrients, that is your carbohydrate, proteins, and fats. You also need to pay attention to the micronutrients, and which became very evident during pandemic, that's where the quality of nutrition, the quality of your eating is important. So, of course, we have huge amount of research available that vitamin C, vitamin D, zinc, vitamin A top the charts in boosting immunity. Of course, they're supported by all the other vitamins and minerals, which I've mentioned over here. So I'm not going to take too much time, but I just thought that, I need to highlight that very often we are very good at taking supplements, okay? But without understanding, I think this is one message which you need to give to your patients, that before you even pop a pill of supplement, look at your diet, take help of a nutritionist, a qualified, trained, professional nutritionist to evaluate your diet, where you are in terms of your micronutrient intake. So if I'm looking at vitamin C, as Indians, all these foods which you are seeing on the screen, are very readily available to us. So something like amla is in season throughout the year. And one amla can take care of your whole day's, vitamin C requirement. Something like guava is in season today. One guava will give you 214 milligrams of vitamin C. So some of these messages need to reach out to people. They should know which are the vegetables which are giving us vitamin C, and of course, which are the fruits which are giving us vitamin C. And remember, always tell your patients that vitamin C, as much as possible, should be consumed freshly cut in form of salads, preferably salads, so that you do not lose this vitamin by heat treatment. Vitamin D, again, a superstar in micronutrients. But of course, as a nutritionist, I would say we are at a loss in terms of the various vitamin D rich food sources. Of course, milk and milk products are, good sources of vitamin D. Egg is a good source of vitamin D, but still, I think the best source is the sunlight. So exposure to sunlight, 11 to 1 p.m., even if it is 15 to 20 minutes, on a daily basis, I think it is good, because now, especially, we are all indoors. We don't pay attention to this. And of course, vitamin D deficiency is rampant in India. Zinc, another important micronutrient, which is again available in so many of your food items. If you look at the quantity, I think egg tops the chart, followed by chicken, followed by your nuts and oil seeds, followed by your pulses. So we need to know that which are the food groups which we must emphasize. Similarly, vitamin A, one message going to the patient that using colored vegetables and fruits will adequately give you a whole lot of carotenoids, which are the precursors for vitamin A, right? And green leafy vegetables for sure, because they are also containing beta carotene. Besides this, animal foods like egg, chicken, fish also give you the ready form of vitamin A. Now, then I bring you to the next concept, and that is that people should understand that how do I get more by eating less? And that is the term which I think every family physician need to understand, and make the patient understand that there is a word called nutrient density. That means how much of nutrients can be provided by one serving, or a defined caloric intake, or a defined quantity of food is the nutrient density of that food. And remember that there are so many food groups which not only provide you one nutrient, but they provide you many, many nutrients. So I take you to, which are the food groups which will give you more nutrients in smaller amounts. So if I'm telling you to have 2 handfuls of nuts, it's not only giving you MUFA and omega-3, it is giving you fiber. It is giving you important vitamins like vitamin E. It is giving you important minerals like magnesium, zinc, selenium. So it's a powerhouse of nutrients which you are getting through that 2 handfuls of nuts every day. But you have to equate it in your caloric intake, that you do away with your HFSS foods and you replace them by incorporating nuts as snacks. Similarly, pulses and dals. I already told you, they are not only powerhouses of protein, but they give you very good quality carbohydrate. And I'll show you some data, what we worked on. The resistant starch content of pulses is highest. And this resistant starch is the quality carbohydrate, which actually creates an anti-inflammatory environment in the body. It works on body fat. It works on the gut microflora. It also works on the blood sugars and lipid profile. Similarly, colored vegetables and fruits, which I just said. So they are again containing a whole lot of vitamins and minerals. And, milk and milk products, I can be very well combined with fruits, nuts, cereals can be combined with pulses. So these are all ways to make your food nutrient dense. And what is to be restricted, I already told you. Just remember the word HFSS, high fat, salt, sugar foods. So always look at what you're consuming and how much of bad quality fat, how much of salt, how much of refined sugar you are adding to your diet. Now, the question is that obesity management is actually telling people how to ration the intake and yet get nutrient density in the limited intake. So, because quality of eating has a bearing on your internal environment. It's not only just counting your calories, okay? Counting of calories comes with your portion size, but with the portion size, incorporating all the bowls in the healthy plate bring the quality of eating. So I just share a couple of things which we have done as our institutional research cell. We worked on something called as resistant starch content of Indian foods. And what I want to share with you is that on raw basis, it is the pulses which had the highest level of resistant starch. Now, what we did was we actually looked at the resistant starch content of commonly consumed food. So what we found that the moment we soak the pulses, we cook the pulses, we germinate the pulses, we combine it with cereals, the resistant starch content increases. Even if something like rice, which is cooked and cooled, the resistant starch content increases. And what's the benefit? The moment resistant starch content increases, the glycemic response to the food decreases. Okay, so we always tell, cut down on your one chapati, but increase the quantity of your dal in your plate. But see to it that you are within a caloric framework which is recommended for your weight status, because by incorporating that pulse in your plate in good quantity and cutting down on your wheat and rice will give you a right balance to control the spikes in your sugar. Even something like dextrinization increases the resistant starch content. This is just a paper which we published, and I don't want to go into the details. It's available. You all can go through at your leisure. But what I want to emphasize is this experimental study we did with adults, and we could achieve 16 grams of resistant starch in their diet just using natural foods. Okay. And within 2 weeks of duration, we could find a decrease in weight, waist circumference, fasting blood glucose, and a significant increase in the beneficial microorganisms in the fecal microflora, which was done before and after the study. So this is just to emphasize that we had significant leads, in relation to anthropometric, biochemical, and gut microbiota. Again, I bring you back to some work which we've done with nuts. And like I told you, these are 5 nuts which normally Indians would consume. So you have almonds, you have pistachios, you have walnuts, you have groundnuts, you have cashews. But if you look at all nuts give you high MUFA. Okay? Then the lowest carbohydrate is there in almonds. Okay, so which means by incorporating 2 handfuls of almonds, you're really not adding carbs to your diet, but you're adding good quality fat. You are getting a whole lot of fiber, protein, highest amount of magnesium, vitamin E, and zinc. Similarly, pistachios lead in proteins and certain carotenoids. Walnuts lead in omega-3, vitamin K1, arginine, folate, and some of the polyphenols, which are very high in walnuts. Groundnuts, again, are high in MUFA. They give you protein, folate, and zinc. And cashews, again, have the highest amount of MUFA, good amount of good quality protein, and important minerals. So what I want to share with you is this is a randomized controlled trial which we just finished and we published in Frontiers in Nutrition in June 2021, where we actually, supplemented or intervened the experimental group with 2 handfuls of almonds. And this experimental group and the control group were actually, adolescents and young adults in the age group of 16 to 25. We screened 1,300 adolescents and young adults. You will be astonished to know that 30% of them had hyperinsulinemia. So from the screen pre-diabetics, we made an experimental group and the control group. The experimental group was given, which is about 56 grams of almonds to be consumed in a day, vis-a-vis an isocaloric control snack, which was given to the control group. And what we found that there was within a span of 90 days, there was a significant reduction in HbA1c, total cholesterol, LDL cholesterol, hyperinsulinemia, and IL-6, which is the inflammatory marker. So what we are trying to say is that, replacing your HFSS snacks with 2 handful of nuts can really have a remarkable effect on your internal environment. So what are the key take-home messages which I want you to remember as family physicians? Of course, in pandemic times, this pandemic is not going to leave us for the next 2 years for sure. But I think we will, by that time, we all will learn to live with the new normal. I don't think so we will ever go back to, where we were. We will always remember to maintain good hygiene practices. We will always, remember to keep safe distance, food handling. All this pandemic has taught us, I think, and this is something which you as a physician, because you are God's word to the patient, must keep on emphasizing. And of course, add to this list, get yourself vaccinated. Then as a nutritionist, I would say that you must tell your patients there is no miraculous diet which can make you absolutely slim in days. Okay. If you are doing those kind of drastic diets, somewhere you are compromising on your internal environment and you will have the repercussions sooner or later. So always encourage them to a food-based approach and help them understand how to get quality in defined quantity. Look for nutrient density. So like I said, eat less, but get more. This is what we have to teach our people at large. Start your day with whole fruits and nuts because they are alkaline, they are fibrous, they are nutrient dense. Make breakfast an important meal so that, again, remember the plate. So see to it that your breakfast has good quality protein, has fibrous carbohydrate, has some good quality fat coming through nuts. And there are various combinations which you can make once you understand what food groups you need to emphasize. Always look at your plate in your lunch and dinner. This is what you have to tell your patient. When you eat food, look at what you're eating as a meal. So look, first thing is ask yourself a question, where is the fiber in my plate? So look at your 2 bowls of veggies. The next question is ask yourself, where is my protein? So look for that protein, look for that egg, look for that katori of dal, look for that katori of curd, look for that chicken or fish, or, in any form which you can have protein, but the protein must be there on your plate. And then look at the quantity of cereal. If you have 3 bowls of rice and, one watery dal, then I think you are you may be not having too much. Your calorie count may be right, but you are definitely not getting the quality. Use fruits and nuts for snacking options. Minimize HFSS foods, which I already said, and also treat the food lovingly. Besides treating the food lovingly, emphasize on moist cooking methods, not extreme heat conditions, low moisture conditions, or, pH of the food in which you cook is also very, very important. So I hope I've left you with some food for thought, which may not be specific, because I always feel that you as family physicians need to give correct generic messages to all your patients. And the second thing you need to encourage your patients is that for specific customization of your diet, please reach out to a qualified nutritionist so that she can guide you correctly.